Welcome back to the morning show here on Arise News. According to the World Health Organization, 1 in 160 children worldwide has an autism spectrum disorder, ASD. Their studies over the past 50 years shows that the prevalence of ASD is increasingly globally. Now, this month marked the 12th annual World Autism Awareness Day. As a growing global health issue, Autism aims, or the World Autism Day aims to increase and develop world knowledge of children and adults who have ASD and put a spotlight on their daily issues. Well, joining us now to speak on the disorder, signs and symptoms, where we are at with the treatments and overcoming stigma is Dr. Nesochi Okeke-Igbokwe. Good morning. Thank you for coming on the show.
Good morning. Thanks for having me.
You're welcome to the program. Well,
thank you.
The World Autism Day was on April 2nd.
Yes.
This is the Autism Week, April 1 to April 2 to 7.
Yes.
Now, but she just quoted some statistics from the World Health Organization,
yes.
1 in 160 children worldwide. We have statistics in Nigeria, and again, is autism spectrum disorder, is it really a disease? Because some people see it as a disease. Is it a disease?
So it is a neurodevelopmental condition. What does that mean? It means there is an issue in the way that the brain is developing, but we're not quite sure exactly why that happens. But in regards to the statistics in Nigeria, it's actually really limited because these disorders are usually underdiagnosed and people are not able to really ascertain or determine what the signs or symptoms are early enough to really detect the condition. So it's sometimes overlooked and people can go for years into adulthood without getting the appropriate treatment that they actually need.
So let's talk about those signs and symptoms, and at what age, ideally, should a child be diagnosed for the best chance of treatment?
So the signs and symptoms are usually categorized into 3 components. So we're usually talking about symptoms that occur when a child may have issues with socializing properly, communication issues, and issues with repetitive behavior. So one may actually note some of these signs and symptoms to be diagnosed adequately at around age 2. So some of those specific signs and symptoms, the one that parents in general get really upset about is the communication issue. Okay, so around the age of 1 or 2, when children are acquiring language skills, one might note that their child is not communicating at all, having speech deficits, or not even speaking at all. So that's a huge cause for concern. And unfortunately, people sometimes confuse some of those signs with something else. In regards to communicating, a child with autism might not be able to engage emotionally with others. They may have issues with actually playing with other children and making those important relationships that they need at a very young age. And also in regards to just the emotional communication that a child should usually have. For instance, if a child of 2 years old were to see an adult or anybody else get hurt, maybe they may be concerned and go to them and approach them to see if they're okay or have some concern. Sometimes in a child with autism, they may be disconnected and may not even note that somebody has felt this pain or is going through something emotionally. When you call their name, they might not be very responsive and may, quote unquote, be in their own world. Okay? And in regards to some of the repetitive behavior that they may exhibit, it's something called echolalia in regards to what they say. They may say the same thing over and over again. They may be fixated with one particular thing. So, for example, if a child is playing with a toy, a motor truck, they'll play with the full motor truck. A child with autism may hold the truck and just look at the wheels and continue spinning the wheels around and only fixate on the wheels. So there are various patterns and things that you see that would make you think that there may be a problem early on.
Well, clearly, autism knows no racial, ethnic, social, religious boundaries. But the CDC in the US is reporting that it is 4 times more common in boys than in girls. Is that a global phenomenon, and why is that so?
So it is a global phenomenon, and we really don't know why boys tend to be more predisposed with autism than girls, but that is a worldwide phenomenon that we do see.
It's in Nigeria and parts of Africa, there is this belief that it's spiritual. That if you have a child, the child may not behaving well, having cognitive, behavioral, social, disorders. From your own practice, how much of a threat does spirituality pose and your interaction with parents particularly?
Sure. So there is no research whatsoever to support that assertion that there is some kind of spiritual connection with autism
and wizards in the family.
No, there's no connection with that at all. So I'm glad you brought that up because there are a few myths that people often have about autism, and one of them in Nigeria is that whole spiritual connection. It's because maybe, there was some sin or crime or something committed, so now you're being punished with your child having autism. That is not a good belief to have. There's no factuality to that at all. Okay. Another myth that people commonly have here as well is that autism is somehow contagious, meaning that you don't want your children around another child with autism
because it's a disease.
Exactly, that you think that you can just catch by having your child around another child. Okay. Children with autism are able to thrive in any environment, but it's just that they need some of the therapies available for them to actually be treated well so that they can actually integrate well in society.
So now that we're addressing the stigma, let's also talk about the treatments. What are the treatment options that are available? What do parents do who have noticed these signs? Where do they go for diagnosis to start off with? What are the treatment options and what are the best treatment options? Okay.
So the main signs or the main treatments that you are going to have is really in the form of therapy. So usually when it's detected, usually it's a teacher in the classroom that may detect this, or parents, of course, at home may detect some of the signs and symptoms. So the first thing you want to do is talk to your doctor about it, talk to your pediatrician about it. So there are a battery of screening tests that are done, and when it is diagnosed, it's a clinical diagnosis, by the way, so there's no blood test per se or brain scan of any sort that will diagnose a child and say they are autistic. So a clinician has to actually diagnose it. And when it is diagnosed, hopefully early enough, then we talk about the different modalities for therapy. One thing is speech therapy. That's important in enabling the child to continue to build their speech throughout the formative years of development. Another therapy that is done is called applied behavioral analysis. That's where they teach children the appropriate behaviors that they should have to try to integrate them well into society. So it's really the therapy that's the mainstay. But with that said, is there a cure? There's no cure for it, but you really treat some of the symptoms associated with it. Sometimes children with autism may have other problems, comorbidities, we call it, associated with the condition. So for instance, sometimes they may have seizure disorder. So of course you would treat the seizure disorder with seizure medications. Sometimes they have issues with hyperactivity or irritability. So there are some medications that can be given to treat some of those specific symptoms of hyperactivity. But there's no one mainstay medication that you would give that would say, I'm treating autism. And the reason it's called a spectrum because children can present in a variety of ways. One autistic child is not the same as the next one. Everyone presents differently. So when they say that a child is on the spectrum, they can have really severe symptoms or they can have very mild symptoms as well.
Well, just a follow-up question. When I look at the field in Nigeria, I see that the pressure is put on parents. Mm-hmm. Some parents even abandon their children. Mm-hmm. Some make the effort to seek help. Mm-hmm. And then there are some stakeholders who have set up certain NGOs or units to assist parents. Is there a role for government in all of this? And what will you be saying to parents who have autistic children? And if there is a role for government, what will you be saying to government at all levels?
So there's definitely a role for government at all levels. Essentially, a problem that we have in the Nigerian healthcare sector is the problem of access to appropriate care and appropriate treatment when we're talking about any disease or any condition. So there needs to be appropriate funding by the government to support some of the initiatives and treatments necessary to help children and adults with autism. So that is their role. And like you said, there are NGOs out there that are, supporting these things, but it's still not enough. In regards to parents, they should not despair. A lot of parents who deal with the issue of having a child with autism, sometimes they are in fear of the stigma. They don't want to go out in public with the child because they're thinking, oh, what is everyone going to think? They think maybe it's a reflection of bad parenting, which it is not. So they need to be there for their child, be supportive, nurture them in a loving environment like they would do any other child, and don't allow the child to feel that isolation or feel that they are abnormal because they have this condition.
Well, you're quite right, because there are some distinguished persons, artists, actors, writers, who are autistic and who have gone ahead in life to do wonderful things.
Exactly.
Thank you very much for coming to the morning show.
Thank you for having me.
Thank you.
Well, we've been speaking with Dr. Nesochi Okeke-Igbokwe. Thank you so much for being on the show. It's now time for a short break on the morning show. When we return, we'll have the Arise News analyst, Manuel Efeni, join us with a review of the top stories on today's newspapers. Stay tuned.